Good afternoon, everyone. Welcome to AVPN's first South Asia Impact Capital Festival. I am Dendera Rikmas, Senior Product Associate with the Knowledge and Insights team at AVPN. I will be your MC for this session, and I'm delighted to have you join us today. For those of you who don't know about AVPN, we are a network of funders and resource providers with over 600 members across 32 markets. Our mission is to move more capital towards impact in Asia by providing social investors like yourselves opportunities to connect with key stakeholders across various sectors and markets, to learn from one another, and to find opportunities for action. We are also sharing highlights of our day live on Twitter, so don't forget to share your experience with us by using the hashtags #AVPN South Asia 2021 and #SocialImpact. Throughout this month, the festival will spotlight best practices and solutions that AVPN members are delivering across India, Bangladesh, Nepal, and Sri Lanka. They will address issues ranging from healthcare, livelihoods, climate action, and education, all of which are of particular urgency for the sub-region today. Before moving to the program proper, a few housekeeping announcements. To download any session resources, please click on the download icon in the agenda page, which is next to the session title. To continue chatting with your speakers and fellow delegates in this session, please make full use of the messaging function or the event feed in the platform. Finally, please note that this session will be recorded and you will be able to access the recording for 3 weeks after the festival. This week, the festival focuses on healthcare. For this session, Gender Lens in Healthcare, we will be discussing the need to incorporate a gender lens when investing in healthcare, as well as within the design and implementation stages of interventions. During this session, we will hear perspectives of a philanthropist and a thought leader as they take us through the challenges and opportunities that lay in incorporating a gender lens in healthcare. And with that, I'd like to introduce you to our moderator, Patricia Mathias, who heads the gender platform at AVPN. Patricia, please.
Thank you, Dendi. Well, according to a World Health Organization report, and I quote, "A central tenet of the SDGs and health coverage is the principle of leaving no one behind. Leaving no one behind is based on the recognition that poor health and well-being are a result of the unequal distribution of power and resources. Programs are also acknowledging that attention to gender is crucial for advancing health and sustaining achievements in health and development. But the question is, how can this be done? How can health programs consider the concerns and experiences of women and girls from diverse groups as an integral dimension of the design, implementation, monitoring, and evaluation of policies and programs? Well, to shed some light on this, we are in conversation today with Neera Nandi and Aparna Piramal Raje. Neera is partner and co-founder of Dasra India. Her overarching goal is to enable social entrepreneurs and funders with the support they need to achieve big goals in areas such as gender, urban resilience, and sanitation through system change and collaborative philanthropy. And being a mom to 3 boys, I understand her goal is also to raise feminist sons. Aparna Piramal Raje is a thought leader on business, design, and workplaces. As an author and philanthropist, Aparna has been thoughtful not just about urbanization and design, but also about gender equality and healthcare. Aparna is also part of an exciting movement called the Asia Gender Network, a network that connects philanthropists from all across Asia so that we can mobilize capital towards causes for women and girls and hopefully achieve some semblance of gender equality within our lifetime. Welcome, Neera, and welcome, Aparna. To kick this conversation off, let me ask both of you, what motivated you to support healthcare and specifically healthcare that serves women? Neera, you can go first.
Okay, I mean, it wasn't a major, deliberating on whether this is important or not. I think it's, it's a basic need. And personally speaking, I think there's a lot that health and women intersects. and we probably don't service and provide and customize enough. But I know we're going to talk about that more. So my motivation perhaps is a tremendous amount of bias, followed by being able to see the challenges that other women actually face.
What about you, Aparna? What got you involved in healthcare?
So I think I have one simple answer for everything on this panel, which is Neera. Because Neera and I have been to business school together. We've known each other for a very long time. But seriously speaking, she has been a guiding force in my philanthropy, as is Dasra. What really happened was that I started supporting a nonprofit called Arman through Dasra and it wasn't specifically because I was looking to support healthcare or gender per se. It's because I wanted to be part of a giving circle and I was convinced of the benefits of that approach to giving. But then Dasra actually guided us to this particular nonprofit, and I can talk about that in more detail. They really sort of showed us why it made sense to support this particular organization.
Aparna, tell us a little bit more about Arman and what has actually connected you so much to their work.
So Arman is a mobile tech for health organization in the area of maternal and children's health. And what they do is they provide voice messages to women across India. They've supported over 23 million women in 14 states across the country. And what these messages are delivered throughout the pregnancy and the early infancy of the child, so that the mother who basically has access to information that she otherwise wouldn't have. So it's intended to do everything from preventive care, like just encouraging them to take their iron tablets, to detecting high-risk pregnancies. And it's a highly scalable and efficient program that has also won a Skoll Award.
Neera, you do some work with adolescent kids, right? And adolescent girls. What has been your experience working in that space?
So I think what occurred to us is, as important as there is the need to really support women in sort of healthcare and health systems, actually we need to take a life cycle approach. So if you can really support young girls, young girls are the ones who become young mothers, and really being able to invest in girls at an early age on a number of different things can actually strengthen not just families, but their own access, their own rights, how they engage in their own relationships. And so just being able to come into the age group of sort of 10 to 19 is a real pivotal age for young girls. And so when we started to, establish the need for investing in girls, we said, why don't we really try and build a collaborative? And in a way that we built the giving circle that Aparna's a part of to really support Arman, we said, basically, can you have a number of different organizations that come together, and then they're supporting, very core outcomes. So the first thing we did when we were looking at how can we support girls, empower girls, through a lot of our research and mapping, we really recognized there's 4 key outcomes that you can invest in for a young girl. The first one is really delaying child marriage. So many of our girls, just reach disempowerment and get pulled out of school because of early child marriage. So if you can focus on keeping them in school and protected, we find that age actually does in fact go up. But the second thing that perhaps relates more specifically to healthcare is actually delaying pregnancy. So because girls get married early, they then are sort of in the family push to have children early, and that just sort of then begins that whole cycle of maternal mortality and infant mortality. So we, really delaying pregnancy is an important outcome for us. And the last 2 are helping girls complete education, and the last one being actually agency. So how do you really help girls find voice and have choice? And if I just have a minute, what I think we learned a lot of, and is important even when we think about, involving women and really having women lead healthcare, is bringing actually boys and men along in this journey. Because as we built agency and choice for girls, they have gatekeepers, and those gatekeepers can have a backlash. And so it is really important that as we not just have a gender lens, but as we sort of embrace gender, it's important to bring men and boys into this, not just conversation, but also actively into engaging. And that's what Arman actually has been able to do quite well, is leveraging, the mobile ends up being in the man's hands. And they learned quite a lot as they worked through the support of the Giving Circle, and Aparna, about how do you engage actually the couple on that journey of pregnancy and having healthy babies.
Yeah, just to add, there was an interesting example that Arman shared with me of a very conservative family where the wife was able to discuss family planning and spacing out pregnancies with her husband once she had these information from Arman. So it's just a very positive example of a
That
wider
is
benefit.
fascinating. Yeah, lovely. Hey, you cannot have a conversation on healthcare without mentioning COVID. So as we've kind of gone through this pretty surreal year, what have been the challenges that have been fed back to you on your programs? So Aparna, was there anything that Arman fed back of challenges they were facing through COVID?
Well, I think the system as such faced huge challenges. So just describe those for a second, which were that, the primary healthcare system was overflooded with all the cases, the COVID cases. OPDs were shut. Women didn't know where they could go for vaccinations or for getting the iron tablets that they needed. So I think all of that was a huge challenge for the system.
Mm-hmm. Anything from your perspective, Neera, that it kind of COVID got in the way?
I think it not only got in the way, but I think a tremendous amount of responsibility and burden really was placed on women across the board, right? I think what's sometimes difficult about these kinds of conversations is to brush, all women with this one color, if I may say, right? But there's an intersectionality, right? Women from a certain economic status, women of caste, women from, proximate to cities, all experienced COVID in a different way. So in one way, it was perhaps an equalizer, but in another way, it was a tremendous amount of inequality in how much women, took so much more responsibility and burden, right? Whether it was, working women in the household having to do additional workloads, all the way to our frontline workers, right? Our healthcare system entirely rests on women in the front lines. And it was those frontline workers for whom there was no question about, are they protected and do they have the right equipment? They pretty much went out. Whether it was our Anganwadi workers, our ASHA workers, A&Ms, they were pushed out to really begin to figure out how to do this COVID. Now that was one piece of it. Another piece, you saw this huge migration of populations moving into rural communities, and who was setting up the quarantine places was all the women of the villages. Mm-hmm. So I think it was perhaps a moment where women came together to really tackle COVID. But I don't think we recognized how much of the burden, I suppose, is placed there.
No, that's right. There's some data that actually shows how some of these parameters on gender equality have actually moved backwards through the last year. But
I wanted to actually, if I can, Pat, add that where I think it's also impacted is we were all, and perhaps this has been talked about, but it's important to emphasize, is many women found protection and safety in whether it was their self-help groups or other groups of women, and the isolation, right, that COVID has placed, that everybody is now in your homes. We've seen a real toll. And so you talk a lot about sexual reproductive health for women, but there's such a tremendous burden of domestic violence and mental health that in this situation of isolation, and I feel that lack of communication and being able to reach out, we saw that have quite a significant dip. So communities and NGOs couldn't go out there and leverage those networks, but we did find innovative ways that women were being able to start access to a phone and things like that. They were beginning to find ways, but I cannot underestimate the real toil of both mental health and domestic violence on women as a result of the isolation.
True. And Neera, on that point, you said women were also learning probably new skills of how to cope. As you look beyond COVID, do you think there have been any learnings, realizations, not just for the women, but for people who are working through that ecosystem, on what we could do more innovatively post-COVID?
You want to go ahead, Aparna, or were you asking me?
Yeah.
Go ahead.
I think that perhaps one of the greatest realization is an overused word, but it is important, is resilience, right? And much of the muscle for resilience pretty much gets built not only in these moments of crisis, but moments before, or life experiences. So I think our natural journey as women perhaps builds our muscle of resilience quite well. And I think that's really been important, not just at an individual level, but also at an organizational level, right? The nonprofit sector went through a tremendous amount of turbulence. Whether it was COVID itself and you couldn't be in the community, so your program costs, you couldn't really use, funders moving, corporate funding really moving out from, this certain kind of programming to respond to COVID, to give to PM Cares. We saw budgets being cut by 40% for some organizations. So some of them couldn't make payroll. So I think there's a number of levels of resilience, all the way to a systems level. That it does beg the question of our resilience at an individual level in India, at an organizational level, is quite strong. It starts to break down when you look at systems and institutions, and that's really what we need to be, strengthening.
Interesting. Well, I want to just shift gears a bit, and as we look forward, try and understand what are the new innovations or trends in how we invest in healthcare, and especially healthcare for women. So Aparna, why don't you share a little bit about your experience with the Giving Circle?
Yeah, so the Giving Circle, of course, has a multiplier benefit, right? Because you're investing X, but you're seeing the impact of 10X, not just in terms of the money, but really in the scale of operations. Like, I think what I tried to do with the Giving Circle was to galvanize my local community, my housing community where I live, and get some neighbors together to put some money in. And we could really see that our money be going a lot further, because we could see this organization grow over a period of time. I know that there are other options in terms of like blended finance and impact bonds, and healthcare obviously is a sector which has very tangible outcomes. So it's easy and measurable in terms of its targets, and particularly Arman has a lot of randomized cluster trials that they do to measure the impact of their work. So, but we haven't seen. I know that they prefer to work with grant-based capital. That works towards organizational development rather than to look at some of these other instruments. So in fact, I wanted to ask Neera actually as to which of these other instruments has she found, interesting or not actually, because Dasra I think also is a lot related to grant-based, right?
Neera, you have the full gamut of visibility. What would your take be? What's innovative, and what are interesting ways of investing in this sector?
So I think we've been perhaps privileged as a country with, the richness of innovations, especially in healthcare, right? And we have everything all the way from full-on public healthcare, all the way from very sophisticated, private healthcare. And I think that tension actually has both pros and cons. I tend to gravitate towards, can our minds, money, and thinking really solve for the public healthcare system? Because that's really where a majority of our population is in fact accessing healthcare. And so it really depends on the kind of innovation and the kind of model with what kind of funding therefore needs to be supported, right? So where philanthropy will come in is it doesn't need to be subsidized because the people and the customer cannot afford to pay for the full cost, right, of that product and service. But as you move down that spectrum, there is tremendous amount of opportunity for certain customers to be able to pay for products and services. Where we need to really innovate is in this middle, right? How can you start to create innovations that are affordable, and with the scale of the country that we have, you can actually build a sustainable business model. It's there where we need to sort of see a lot more, innovation. I think what is exciting in the healthcare space is exactly what Aparna was leading into, where you can really look at outcomes. What I would love to be able to see is innovative financing that really improves the quality of care in public systems, right? So it is the public system that has been catering to COVID, really trying to figure out, and that's where some of that social impact bond piece, but unless the government steps in aside and sits at the table and begins to really invest in improving that quality of care, we're not going to be able to solve this.
And are you seeing a lot of use of technology in India, Neera, as an innovative way of reaching women? Aparna spoke about that with Arman. Are you seeing that more broad-based?
Yes, absolutely. I mean, I think we have to be careful because we sometimes just equate the ability to scale with technology. It is an enabler. And really thinking through innovatively how it can be disruptive or how it enables. It is not the solution in and of itself. We are seeing more and more organizations bring that kind of innovation in the startup. But the challenge is not the technology itself. The real amazing part of what Arman's been able to do is actually build a platform for which it engages directly with women. The technology, again, is an enabler.
Well, with just a few minutes left, I thought we could do a quick series of questions, kind of a rapid fire. So either of you could answer, but let's start. Any book or article that you have found interesting or that you would recommend that would broaden our understanding of gender lens in healthcare?
So it's not gender lens in healthcare particularly. I'll just put a slight caveat, but I will say How Will You Measure Your Life by Clayton Christensen. He's a Harvard professor, is a fantastic book that I think anybody should read, especially if they're interested in giving, because it has some very useful tools that you can use in your life.
Any article you've come across, Neera?
Yeah, I think my book is a bit heavy, so I perhaps should apologize, but it's called Cast by Isabella Wilkerson, I think is her name. It made me cry at different sort of stages of reading it, but it's less about the tears. It's more about, it sort of opened my eyes to caste in a way that reframes sort of power and privilege. And the reason that I bring that up is I do believe that some of what we're tackling, in the gender space actually has to do with power and privilege. And it really speaks to a lot more around race, and color in the US. But, we don't draw enough on how caste actually is so deep in our country and its implications and therefore further vulnerabilities on gender.
Organization that you admire, Neera?
Oh, an organization that I admire. I guess this is the same theme. There's one called the National Campaign for Dalit Human Rights. So it's probably in the same theme of this book, Cast, which is we need many, many more organizations that help lift and amplify and really support the most marginalized and the most vulnerable, and they sort of run legal clinics. They sort of help on rights movements for the Dalit community.
What about a funder who we could learn from? And if a funder in the healthcare space?
So, well, I have three funders that I could learn from. The people I know, one is Amit Chandra. He gives a lot, but I think more than that, he has a multiplier effect because he gets other people to give. He's a Bain consultant and he's a well-known philanthropist in India. I like Pramad Sinha, who works on education because of his focus and what he's been able to do. And at a personal level, my uncle Ajay Piramal has always inspired me. He's backed a lot of social entrepreneurs. I liked his approach to philanthropy. Also, he looks at it, very seriously. So each of these three.
Interesting. How about, is there a government that is employing models for gender lens in healthcare?
I do think the Ministry of Health is seeing at a central level the importance and the need for engaging gender very specifically, but women. And in fact, we were asked to come in and really work through with a group of organizations, how do we just decrease the stigma of COVID at the front line so that, women can participate and engage. So I think it's becoming a need rather than, out of the kindness of their heart, if I may say. And so as that becomes a priority at the central level, we're seeing much more happen at a state level. We work a lot with our adolescent girls work in Jharkhand. And so have seen there a lot more of a push in how their adolescence is a focus on the health side. It ends up being sexual reproductive health. There's a lot more now going on with how do schools intersect with health. So where we need government to begin to think about is break some of these silos, right? You don't break the girl or the woman into education and health. And so some convergence we're seeing states being willing to do. And I think that's going to be a real game changer.
Yeah, actually, I forgot to mention also, I didn't want to give the impression that Arman works on its own. It works very closely with governments, and it's been asked to take over 2 major government programs in the same area of technology for health. So, yeah.
Nice, nice. Any reapplication examples from other countries that you think would be relevant to South Asia? Anything you've seen beyond?
Well, I think this is not a new concept per se of voice messaging or text messaging. And it's just that in some countries it's done through text messaging. But I think reaching out to women in many ways, I mean, I got emails when I was pregnant from Johnson & Johnson. So I think that and this is an adaptation of something that has definitely worked across the world.
Nice.
In fact, speaking of Arman, just the other day, we had a group of philanthropists about 1.5 years ago from China come to India to really learn about philanthropy. And they had actually met Arman coincidentally and Aparna. And these Chinese philanthropists are actually supporting a health organization in Myanmar. And just yesterday, we're saying, can we be reintroduced to Arman to really try and bring the same technology and access into Myanmar. So I do think we will see more and more innovations, because if you achieve scale in India, it's pretty much relevant and can easily be applied elsewhere. So we're seeing much more move from India out into Africa, but it's largely been around agriculture. I think if we can really move some of these healthcare scalable models, we'll see more of that.
That's interesting. I mean, I've seen Aparna share some learnings with other network members from Indonesia, and they actually found that there could be a lot of similarity in how India is approaching it, and it could travel to Indonesia. Okay, just as we wrap up, last question. I feel optimistic about the future because
of the people who work in the sector and the people who fund it.
Okay.
I feel optimistic because of women having greater influence and leadership in the world.
True, true. Well, I feel optimistic because women like you are taking a stance, you're understanding the challenges, you're unpeeling the onion, and you're really working the system to make a change. So thank you for everything that you do, Neera and Aparna. I enjoyed this conversation with both of you. And I hope that all these various efforts across the country will all have the multiplier effect that you all both talked about. Well, the World Economic Forum reports that it will take about 100 years before we have gender equality. Well, hopefully in the healthcare space and in our part of the world, we'll see it sooner. Thank you very much, both. It was a pleasure having you on this panel.
Thank you. Thank you.
We have now come to the end of the Gender Lens in Healthcare session. This session is made possible with the kind support of our festival partners, Bill and Melinda Gates Foundation, Sesame Workshop India, the Rockefeller Foundation, COVID Action Collab, V&V Advisory Services LLP, British Asian Trust, WPP India CSR Foundation, Catalyst Management Services, PTE Ltd, and SATVA. We encourage you to continue chatting with your speakers and fellow delegates of this session, so please make full use of the messaging and meeting function of our festival platform. Do share your highlights of this session on social media and remember to tag us using the hashtags #AVPN South Asia 2021 and social impact. Up next, the session on using data to drive crisis response management will be starting at 5:20 p.m. IST. Thank you, and please enjoy the rest of the festival.